Welcome back to the Bryan Devore Connection. I am your host, Bryan Devore, and with me today is Gabrielle Pumpian from The Key. Gabrielle, how are you doing today?
Good morning. I'm well. How are you, Bryan?
I'm doing great, thank you. So you and I have worked together for a while because we are both in the sort of elder care space. There's a stat that I saw the other day. 10,000 people a day are turning 65 years old in the United States. That those generations are getting larger and larger, and they're going to need a whole lot of care. So I wanted you to come talk about The Key, your company, what it is you guys do, and how you fit into the realm of elder care.
Yeah, thanks, Bryan.
Yeah.
That wave of older adults is called the silver tsunami, and it is true that more and more people are turning 65. They're becoming eligible for more long-term care and healthcare benefits, and they need solutions when things come up, and also solutions for planning. So we at The Key hope to provide that for our communities and our referral partners. And our company was formerly Home Care Assistance. We've been a leader in providing in-home care services across the country and in San Diego for 10 years. So very excited to offer more information.
Great. So yeah, The Key, you guys have a wonderful company. I've always admired the work that you guys do, not just for the seniors that you serve, but their families as well. Tell us the stat you told me before we started filming.
Yeah, I think everyone can really relate when they get put in a position of having to care for an older adult or a loved one. I just heard that 1 out of 5 full-time working Americans is also caring for a loved one. And so life gets stressful, and people need to know what's out there to support them. Nobody teaches you about how to care for your loved one. There's a lot of resources around childcare and things like that, but usually people don't get the experience until they're living it. So our company not only strives to provide excellent in-home quality caregivers, but also a resource to the community to help them understand the true nature of what all encompasses in caring for an older adult long-term.
Got it. We were talking before we started filming. You have a family member that you're working to help as well. So we're sort of in that sandwich generation, as they call it, where we have younger ones. You have younger than I do, but younger ones to care for, and then your parents as well. So it puts us in a kind of a tight situation. So to have the resources provided by a company like yours are super helpful.
Yeah, I think the nature of supporting people long-term in their home is changing. I think kind of the old philosophy's been, you know, someone gets old, they get sick, you maybe move them into a place, you put them in a nursing home, you visit on a regular basis, but more and more people are finding that not what they want, and that's not only the elder doesn't want to move, 90% of people want to age in place in their own home, but then also the family, you know, the burden of having to find a place and make sure they're getting adequate care, what all of that costs and entails. That can be really overwhelming when someone's sitting in a hospital bed ready to be discharged. So The Key comes in as a place to talk about options. We connect with home health and hospice providers. We work with medical device companies, geriatric care managers, folks like you, to really teach and educate people how to find the resources that they need. And then also explain that unfortunately in this country we're not set up to provide, the government's not providing long-term care insurance. It's something that folks have to pay into independently, and folks have to have savings in order to afford the cost of care at home. So I think we have a lot to do in this country to work towards kind of making it accessible for everyone. But the first step is really having quality services to provide. And we believe our caregivers, they're the heart and soul of what we do every day. Our goal is to support them in understanding, you know, who the client is that they're working with, what the nature of their disease is, anything from physical to mental and cognitive impairment, because everybody's very different and unique, and it takes a unique approach to care for them in a good way.
Absolutely. One thing you just mentioned was long-term care, and it's hard to navigate that. And you mentioned to me that one of the things that you guys help with is sort of helping navigate, you know, what is long-term care going to cover, what are they not going to cover, so people don't have to just look at their policy and say, okay, now what? And especially in that crisis mode. And as we both know, most of the calls that we get are in crisis. One of my main objectives through doing videos like this and just being out in the public is to educate people on what's available before they need it, because crisis doesn't make an appointment. So
no, it doesn't.
People get kind of stuck.
Yeah.
Now, it's important too when you talk about people caring for their loved ones themselves versus home care, or maybe even going out and finding someone on their own, however they may do that. And there's a big difference between that and hiring a company like the Key. Talk about the difference between going private versus having a company like yours.
Yeah, that's a great question. So we provide a lot more liability coverage for the client. So our service is, we're a full service agency. We're registered, every employee is registered with the Department of Social Services. They've undergone a thorough background check by the Department of Justice and FBI. We've provided them at least 5 hours of annual training. They're W-2 employees, so we pay their payroll taxes, and then we run a 24/7 concierge operation. So all of that goes into the hourly wage that you pay agency. Hiring privately can be a great option as well. You may be able to be a bit more choosy. Maybe someone is going to be with you a long time or be able to live in with the elder person needing care. But you, as the employer now of that contracted person, is responsible for your liability coverage, your payroll taxes. And so you just need to make sure you're setting yourself up to protect your home, your assets, and your family when you are hiring privately. But it's not to say that agencies work out for everyone. You know, we are all facing a staffing crisis right now. So our company is really getting innovative and trying to find the best ways to retain caregivers, to hire caregivers, to make this job a desirable position. And I think that that's also an important shift that needs to happen with caregiving in general on a systemic level to create better jobs for caregivers. We really focus at the Key on providing a long-term care service. So we may start out with just a couple days a week with someone, a few hours, go over there, provide companionship, maybe take them to their appointments, make sure they have good healthy food in the fridge and that they're bathing, all the way up to 24-hour care. But it's about developing a relationship with an agency, with a caregiver, or with somebody private to ensure that they are going to show up every day that you need them, and everyone's happy with the work that they're providing, the service.
Yeah, and like you said to me before about having that commitment to having the care. You know, you can't just bring someone in for an hour or two every other day or whatever.
Yes.
It's that continuity. And one of the benefits of having a firm like yours is they get to know the caregiver. You know, you're gonna meet with them and match them with the right person. Versus if you just hire someone, you know, however you're gonna do it on your own. It's sort of a roll of the dice, and you don't necessarily know, which is one of the reasons why, like you mentioned, the cost that goes into home care is not just for the caregiver, it's all the other things that go in behind the scenes that people don't see.
Exactly. We have a 24-hour line that people can call if they need to add care or if the caregiver has an issue and ends up calling out for a shift. We have staffing managers working after hours and on the weekend to ensure that there's a replacement who's going to care for that person so people aren't left empty-handed. Those are the benefits that you get with an agency, and if your private person calls out, you may not have a replacement. But we really strive to provide the continuity, and so we set that right expectation with the family at the beginning and understand what is the long-term goal. You know, is your goal to have mom stay at home independently as long as possible and eventually add in care? Will you see a need for more assisted living in the future? Can we help you, you know, connect with a placement professional to find the best option when you're ready for that? All of those kinds of things go into our services too.
There's a lot.
There's a lot.
There's a lot that goes into this.
Yes.
So it's great that companies like yourself and like you yourself are involved in things like that. So Gabrielle, thank you very much for coming. You can visit their website. You can contact Gabrielle directly yourself. All her information is on the screen here, and you can learn more about the Key and why they are the key to helping your loved ones. Thanks again for watching.